Piriformis syndrome, what is it? What causes it? How do you get it? And how do you fix it? I'm Dr. Jen. Let's jump right in, okay? Piriformis syndrome, it's a musculoskeletal issue. It occurs when the piriformis muscle compresses your sciatic nerve and results in inflammation. Now, this inflammation can cause pain or numbness in your butt or down the back of your leg. It can happen on one or both sides of your body. Now, I know you're probably saying, okay, sciatica. I've heard this word, sciatic nerve, sciatica. Is this the same thing? Well, the answer is no. There's a difference between piriformis syndrome and sciatica. They're often and sometimes related, I should say. They both affect the sciatic nerve, but they are different. So when we talk about sciatica, we're often referring to a herniated disc or spinal stenosis that causes sciatica. The symptoms affect the lower back, can travel down through the buttocks to the leg. Piriformis syndrome only involves the piriformis muscle pressing on one area of the sciatic nerve in the butt. So it can kind of feel like sciatica, but in a more specific area, okay? So you're saying, well, how would I get this? How did I get this? What's going on? Well, anything that presses on the sciatic nerve, sort of in that area, anything that rather makes the piriformis muscle press on the sciatic nerve in that area can cause piriformis syndrome. So I would say the most common causes are like inflammation or swelling around the piriformis muscle or the tissues around it, or like maybe a muscle spasm or scarring in the muscle. And, how do you get that? Well, it can be simple or complicated, right? So simple things is like climbing stairs, walking or running. If your muscles aren't strong enough, injury or trauma can do it. Having tight muscles, like from lack of sort of stretching, or maybe even things like lifting something improperly or not warming up before activity, any of those things can contribute to it. So you see, it can be complicated or simple, the things that can bring it on, okay? By the way, I want to thank Cleveland Clinic for this information. I think it's really great, so I want to list them as my source. Symptoms, right? What are the symptoms? Aching, burning, numbness, tingling, pain, shooting, sort of pain or numbness and tingling. And sometimes certain activities that you're doing may actually make those symptoms worse, okay? Now, the good thing is, all right, there are treatments, and there are pretty decent treatments. I first want to start out by telling you a treatment that's near and dear to my heart. I am an osteopathic physician, and I believe in osteopathic manipulative treatment, OMT. It's a hands-on modality that we can use to help musculoskeletal complaints and other complaints as well. I'm going to link a video here if you're watching on YouTube, so you can check that out. If you're watching on Facebook, please just shoot me a message and I'll send you the video. But check that out. Osteopathic manipulative therapy or treatment can be awesome, okay? Other treatments that can be good. Home exercises. Home exercises are awesome for so many different things to make sure that you are stretching and strengthening that piriformis. Also, non-steroidal anti-inflammatory drugs. Those are like NSAIDs to help lower inflammation. Sometimes things like massage can be helpful. Heat can be helpful. Muscle relaxants we use sometimes in this situation. Dedicated physical therapy. I cannot speak highly enough about physical therapy. It is amazing. And then also injections, steroid injections or others. So there's a lot of things you can do. I want you to have hope. Write in the comments if you suffer from piriformis syndrome or think you might or know someone who does. I'm Dr. Jen. It's good to see you. Please subscribe to my channel on YouTube. Follow me on Facebook. I'm on TikTok, Instagram, LinkedIn, WhatsApp, etc. Follow me everywhere. Also go to my website, drjencaudle.com, to sign up for my free health newsletter. Love y'all.